Welcome. Welcome to Healthy Living in Lowell, a production of the Lowell Health Department and many of its community partners. I'm Carrie Dentremont, Executive Director for the Greater Lowell Health Alliance, and I'll be moderating our show today. This show today will be focused on youth mental health and wellness. Our guests today are all members of the Greater Lowell Health Alliance Mental Health Task Force. This is a group of behavioral health providers, public health professionals, and community members that all come together to work together to ensure that mental health is as important as physical health. Our group meets monthly and is open to the public, and for more information you can visit greaterlowellhealthalliance.org. So welcome to our guests today. I'm very happy to be here with you. On our first segment of the show, we have Melissa Dickinson from South Bay Community Services and Lisa Rodriguez from Greater Lowell Pediatrics. Thank you so much for being here with us today. Melissa, could you tell us briefly about the work that you do at South Bay Community Services?
Sure. Again, my name is Melissa Dickinson. I'm a licensed mental health clinician at South Bay Early Intervention, and we work with children ages birth through 3 to promote positive mental health and well-being.
Great. Thank you so much. And Lisa, could you tell us a little bit about your role at Greater Lowell Pediatrics?
So I'm Lisa Rodriguez. I'm a pediatric nurse practitioner, and I specialize in child and adolescent mental, behavioral, and emotional health. What we're working on at Greater Lowell Pediatrics is improving access to mental health services within the Lowell community, lessening the wait times for appointments, especially to see a prescriber, and addressing the mental health concerns of our young children.
Well, mental health seems to be the buzzword these days. It seems to be on everyone's mind. And as we begin our conversation around youth mental health, I think it's important to first talk about prenatal mothers, or mothers who are pregnant, and how their mental health and well-being affects the child. So Melissa, could you tell me a little bit about the connection between caregivers' mental health and that of the child?
Sure. Well, we know for our infants that their mental health or well-being begins at the moment of pretty much conception. So if a mother is struggling with her own emotional health or well-being, she may be anxious, may miss her own prenatal appointments, may not be taking the best care of herself, may engage in riskier behaviors such as substance abuse. So that really puts that child or infant at a greater risk for some mental health problems later on, because the mom is maybe struggling to take care of herself. So we know that prenatal mental health is very important.
Okay. And how does South Bay Community Services work with caregivers and families to address some of these concerns?
Sure. So once that child is born, we can be in day one. We actually visit children who are born in the hospital pretty much right after, and can interview and do our intake process there at the hospital. And we really work to remove those barriers that prevent caregivers or parents from forming a healthy attachment with their child. We know that children navigate their world and their environment through their caregivers. So any of those barriers that may prevent that parent, that grandparent, caregiver, friend from forming a healthy attachment to helping that child understand their world is where we start our work.
Okay. Great, thank you. And Lisa, in your role at Greater Lowell Pediatrics, you work with children of all ages. Are you seeing young children experiencing mental health issues?
We are. So, and this has been a challenge within accessing mental health services across the country, not just in Greater Lowell area. So we're talking about it. We're opening up access. We're trying to decrease the wait times to see a provider. We're working closely with therapists, other community resources, DCF, parents, caregivers, friends, daycare providers, and teachers that may have concerns about a child that may or may not seem out of the norm. And how do we identify that? So let's talk about it. Let's bring it to the forefront. You know, much like you would talk about your asthma or your poison ivy or your growth and development, your emotional health is part of a growing, healthy, happy child. And so we want to keep that moving forward and offer those resources like South Bay and other
community agencies.
and other community agencies to foster, healthy child development and healthy families within the community.
And this is a great spot where early intervention may intercede if parents, caregivers, or anybody is having a hard time making that appointment with their pediatrician, that's something that early intervention we can go into those appointments, or we can help make that phone call so that we're removing that barrier to that access of care.
Right, right. And Lisa, what specific diagnosis are you seeing?
So there's a spectrum of diagnoses that we see. Recognizing if a behavior or emotion or mental health is concerning is the first step to recognizing and talking about it. Should I be concerned about this? Is there something I can do about this? Whether it's ADHD, anxiety, loss or change, adjustment within a family, substance abuse. We're seeing our youth struggling with their identity and maybe some gender issues and the mental health issues that go along with that and how we can help. And my role at Greater Lowell Pediatrics is to work with the providers, and if the child could benefit from some medication, how we're going to manage that and open up the conversations and break down the stigmas of mental health.
Absolutely, thank you. And how might a caregiver actually diagnose a child that might be having some of these symptoms?
So if a caregiver notices that a child has some behaviors that don't seem within their developmental level, or if a teacher or a daycare provider, another parent, grandparent notices that Johnny seems a little bit anxious around transitions. Are you seeing this at home? Having home and school and other caregiver conversations. So we're encouraging everyone to talk about it. Is this happening at home? Is this happening at school? Is your child sleeping well at night? Are they struggling with a parent home that may be in discord or divorce? So how can we help that child navigate through all of this together?
Right, right.
Yeah,
Thank you.
I think a key thing Lisa said is their behaviors. Children navigate their world through play. They replicate what they see. So if you're seeing something kind of off in their play, that can be a key indicator to a parent or a caregiver. As Lisa said as well, right, really using our collaterals or people who are in contact with that child, because oftentimes parenting is hard, right? We might just chop it up to one day, but if we're seeing things throughout many different areas, then listening to what others have to say. And
Great. And Melissa, what are some of the resources that are out in our community to help?
Yeah, sure. For, again, the birth age to 3, early intervention is a great place to start. But other than that, once a child is 3 and up, they can be available for outpatient therapy, IHT therapy, but also, again, since children navigate through play groups, your local library, really being present with a child and helping them, again, understand is a great place to be, especially if services have such a long wait list. So really, anywhere a child can be a child.
Right, great, absolutely. And for both of our panelists, what can parents, grandparents, caregivers, what can they do to reduce those risk factors that might cause some of these health-related mental health issues?
I think the big thing that I guess I just said too was just being present. I mean, really understanding your child, being there with them, validating their feelings. For young children, especially 0 to 3, teaching them about feelings, what they are, what they look like, is huge. Helping them have that basic education of what's going on inside their bodies.
Great.
And like Melissa said, listening to your child. If a child says to you, I can't get out of bed to go to school. Well, talk about it. What's going on? Let's talk to your therapist about it. Let's talk to your pediatrician. Let's talk to other providers. And then offer support for the caregivers. So oftentimes the caregivers feel alone, like that. Is my child the only one experiencing this? Is my family the only one experiencing this? We have a lot of grandparents raising their grandchildren. We're seeing that more often, and connecting them, offering support groups, support networks, connecting them to self-care, such as checking in with a therapist themselves. What are they doing to take care of themselves and have some downtime, so they can help take care of the family or that child that might be struggling with some mental health struggles.
Okay, great. Great. Well, thank you so much for being on our show today. Is there any last minute thoughts that you'd like to mention before we end?
Just like highlighting what Lisa said, is parenting is hard. This is hard to navigate, so really making sure the caregivers have some support as well.
Great.
And years ago, we were afraid to talk about mental health. We were afraid to, what would the stigma be? What would people think if I talked about my depression or anxiety or the moods and feelings that I'm having? So talk about it, bring it up. It's better to talk about it than to not talk about it.
Absolutely. The more you talk about it, the less the stigma. So thank you both so much for joining us today and bringing all of your valuable resources and your expertise to our audience. So thank you for joining us. So stay tuned, and we'll have another segment coming up shortly. Thank you. Hi, and welcome back. We just heard from Melissa from South Bay Community Services and Lisa from Greater Lowell Pediatrics regarding mental health in young children. I'd like to continue our conversation today as we introduce our next panelists, Jake Kavanaugh of the NAN Project, Lori Friedman from Greater Lowell Technical High School, and Sarah Alexander from Lowell Community Health Center. Welcome. Let's start off by telling us a little bit more about each one of your organizations and what you all do.
I'm Lauren Friedman from Greater Lowell Technical High School. I've been an adjustment counselor there for 14 years, and our school is a public school for grades 9 through 12, where students are able to learn a career path as well as their academics.
I'm Sarah Alexander, and I'm a pediatric clinician in the pediatric department. I'm sorry, a behavioral health clinician within the pediatric department of Lowell Community Health Center. And Lowell Community Health Center is a very comprehensive health center that offers medicine, medical care, as well as behavioral health care, OB/GYN care, just a wide variety of services for the Greater Lowell community.
And my name is Jake Kavanaugh. I am the co-founder and director of the NAN Project. We're an organization that promotes mental health awareness and suicide prevention programs for youth across Massachusetts.
Great, thank you, and thank you all for coming today. We'll just dive right into some questions, if that's okay with you. As we've just heard from our last panelist, mental health is a growing concern for our children. Lauren, could you tell us a little bit about what you're doing and what you're seeing among high school aged youth?
Sure. I would say recently we're seeing an increase in anxiety and an increase in substance use and abuse. And I really believe the two are related, because as the anxiety is increasing, the students are looking for ways to bring that down. I think the anxiety can be from a number of reasons. It's a lot deeper than the anxiety we saw in high school, when we were just a little nervous about something. Now it's a lot deeper, and on different levels, it is causing a lot of refusal behaviors, from just refusal to do work in school to refusal to coming to school at all. And then it could be, from social media as well. A lot more social media use is happening right now, and I think we're seeing that increase in anxiety from just the increased exposure to the electronics, but also an increase in isolation. The kids are by themselves using their phones, so they're not interacting with people as much as they did before.
We know that mental health issues and substance use are risk factors for suicide, and we're seeing a 60% increase in suicide rates among young people over the last 5 to 6 years.
Wow. Wow.
I
think add to that?
Yeah, I
Sure.
think it's important just for people to know, what are some of the symptoms of anxiety, and it includes just fear, panic, nervousness. Those are things we often think about, but it also can include irritability. It can include isolation, and it includes a lot of thoughts that are like they always talk about overthinking. That's a common phrase right now. But that's very true. That makes it very difficult for kids to step away from the anxiety. But it is treatable. That's something that's just incredibly important for people to know. It can be treated, and the sooner you treat it, the less impact it has on the rest of their lives.
Yes.
And so our efforts are always to try to get the child into therapy quickly, and medication can be helpful. And learning lots of skills can be very helpful. One issue that has come up, I think, more recently in Lowell that's definitely impacted is for kids who had this serious anxiety that made it impossible for them to go to school or to really do work, we used to have the Lowell Treatment Center, which was a place where they could go for a few weeks and really get very helpful, learn a lot of skills, take a break from school, but work on their anxiety and go back to school in a much stronger way. But that closed a few years ago, and so we really have a gap in services in Lowell for those kids. Now I know the schools have been, Lowell High School and the Voc, excuse me, have been trying to really step up to that and offer some programs where they can slowly move back into things, but there's still needs not addressed. But you may be able to say what they're doing at the Voc, which I think is really good.
Yeah, that's a great segue into how Greater Lowell Tech has responded to this crisis and these issues, and how have you all been responding to mental health diagnosis?
Sure. Well, I've been at the Voc for 14 years, and I would say that these have all been increasing a lot in the last 3 to 5 years, especially with the legalization of marijuana, and it's more accessible, so students are definitely using it more. And trying it and just have more access to it in general. So we've done a lot of work in the last 3 to 5 years at Greater Lowell Tech about trying to come up with interventions on several different tiers. One of them is a tier 1 intervention, which applies to the entire school, where we've been trying to help teachers understand how traumatic events affect students, how to talk to students to get students to do what they'd like them to do, how to teach the soft skills and model those skills so that students are able to learn how to kind of navigate, to create healthy routines for the students as well. So that's called social emotional learning. We've been doing a lot with that. We have more specialized interventions like therapeutic homerooms and substance abuse groups that occur after school. And then as our latest program is called the RISE program, and it is a structured, supported program for students who have missed an extended absence from school. They've been out of school for 5 or more days due to medical or mental health reasons. And the RISE program offers them a place to come back to make up their schoolwork and return to classes with support. There's a clinician in the room. It's a short-term intervention. It's 6 to 8 weeks, just to get the students kind of back up and running with support, though, knowing that people care about them.
Wow, that's really great. Now, Sarah, maybe you could speak a little bit more specifically on anxiety and depression among teens and what this really looks like within our community.
Well, to think about depression, oftentimes anxiety and depression come together, but a depressed teen would certainly be isolated as well. Often you think of them as having a low mood. They can sometimes argue a lot when they're depressed. That can also be there, as well as crying a lot. Sleep difficulties is huge part of depression, and sometimes you see appetite changes, and those are all things to be thinking about. A lot of times parents know their kid is not doing well and see changes, but they often see it as an attitude issue because the child is having a really hard time doing schoolwork, having friends, doing anything, doesn't want to do anything, and so argues a lot and seems very negative. And that can look like an attitude problem, but in fact it is depression, and it really needs treatment. And again, the sooner the better. Depression is very treatable with therapy, and medication can be very helpful. People often do both, but one or the other is very helpful and really can make a difference in terms of helping the child to go back to school and regain the kind of functioning they had before they were depressed.
And I think the first step in that is being able to ask for help. And because of the stigma that surrounds mental health issues, for a young person, it can be really, really difficult to ask for help. So being a parent that can recognize some of those signs that you've just listed and reaching out to their young person and sort of providing that intervention and getting them the help they need is really important.
Yes. And, depression often results from something. And some of the things that I think we see here in Lowell a lot are, when I say from something, some event that occurred in their life, and it might be a loss, including the death of a relative, a grandparent, an aunt, I feel I see a lot of families that have lost a close family member at a young age and unexpectedly. Those are harder deaths to manage and recover from. And the other loss that I feel we see a lot of in Lowell, people coming from another country and settling here, or another city within Massachusetts, or another state. And so they're really without the supports that a family that has lived here for 20 years might have. Many more friendships, many more connections, many more community, family supports. And there are many, many families without a whole lot of supports. And it's very tough, especially for older teens, I think, to adjust to these moves and adjust to the social, a whole new set of friends, a whole new community, a whole new set of expectations, different teachers, and no familiarity with what was there.
And often they move around quite a bit, so that
yes,
can be really
this
hard
is
for
not
them.
their first move by
And all
any
of these are
means.
part of a number of, I think, traumatic experiences that a lot of our
Absolutely.
students have had.
Yes,
Yeah.
yes. And anxiety can result
From all of that.
from traumatic events as well. And this includes, witnessing something very life-threatening, but it often kids are talking about feeling bullied, and that's a situation that can make them feel very fearful about going to school.
Well, that's back to the social media use as well. I
Yes.
think kids are a lot more brazen in saying things on
Yes.
their phones than they used to be, and then they're
Yes.
also, like I said, spending a lot more time alone. So they're having
Yes.
less practice in these social interactions. So there's a
Absolutely.
lot of interpretation and even misinterpretation too about
Yes.
what's going on with their peers, and they don't have a lot of guidance because they're doing this all alone in their rooms.
Yes,
Right.
Yeah.
yes, I agree completely.
Great point. Now, Jake, your project or program works specifically with middle school and high school age youth, specifically around mental health awareness and suicide prevention. Could you tell us a little bit more about your project?
Absolutely. So we work with a peer-to-peer model, which means we work with young adults who've had their struggles with mental health issues, be it depression, anxiety, bipolar disorder, kind of whatever it is. And we work with them to develop what we call comeback stories, where they talk about their experience as a 16-year-old with depression or a 17-year-old with anxiety, and what it was like, what those feelings were like, but more importantly, what were some of the supports that they could turn to when they were struggling. And they go into classrooms typically and talk about their experience, with the idea of kind of taking down some of that stigma around mental health. Another piece that we do provide for both youth and for teaching staff is a program called QPR, Question, Persuade, Refer, which educates and sort of empowers people of all ages to recognize the signs that a friend, relative, student might be struggling, and what do you do with that information? We're not all clinicians, but we can assist someone who's in crisis.
Great. Wow. And how is the NAN project engaged in the community?
So over the last year, the Greater Lowell Health Alliance has really opened quite a few doors for us. We've done work with the Boys and Girls Club, CTI Youth Build, Greater Lowell Technical High School, as well as in Lowell High School. And kind of one of the highlights, I'd say, of the last year was we provided that QPR training to a group of students called Global Citizens, who are recent immigrants, so that they would have the tools to assist a peer who is struggling. And that was sort of, definitely one of the highlights of the last year. And I'd also like to give a plug to the Lowell Firefighters 5K on September 22nd. A portion of that funding will be going to the NAM project.
Great. Excellent. Lauren and Sarah, what services are available in our community to meet the needs of these middle school and high school age parents and for their parents?
Well, at Lowell Community Health Center, because it's a very comprehensive organization, not only do we have behavioral health services within pediatrics and very accessible for individuals, but we also have the Teen Block program, which is an after-school program for 8th grade to seniors. And lots of kids come to it directly from Lowell High School or the VOC, and it's a program that has a lot of different specific offerings. They have dance, they have art, they have computer classes, they have help with homework, help with senior planning, and after high school planning, there's just a lot there that is very, very supportive. And for teens new to Lowell, I think this is a very, very helpful program. And then we also have the teen clinic, which allows kids to come, particularly Thursdays. They don't need to have a parent with them. They can get access to any kind of reproductive medical support and referrals for other support if needed, and it can be a very helpful support for kids.
Okay, great. Well, it looks like it's time to wrap up, but I'd like to leave with what can parents and grandparents and caregivers do to help the situation?
I think one of the bravest things that anyone can do is to ask for help and to get help that's needed for yourself or for your child. And I think one of the best places to start with that, if you don't know where to go, is the NFI Family Resource Center in downtown Lowell on Prescott Street. They have walk-in hours, and you can just go walk in and say, I need help, and then they'll help get you to where you need to go. There are also a number of agencies that provide counseling, like Wayside, South Bay, VinFen, Center for Family Development. So there are plenty of places to go for help in our town.
Great. Well, it looks like we're out of time, but I really want to thank all of our panelists for joining us today. Thank you so much for sharing your expertise and being here with us today. And I'd like to thank you for tuning in. Thank you so much, and please join us next month to learn more about healthy living in Lowell.